Asthma is a chronic inflammatory disease characterized by structural changes in the lower airway. It manifests through paroxysmal respiratory symptoms and reversible or partially reversible obstruction of the airways. Severe acute asthma is defined by an intense attack resistant to standard treatments, accompanied by clinical signs of severity, distinguishing severe asthma from other conditions with symptoms like cardiac failure, embolism, chronic obstructive lung disease, or foreign body blockage. Can be sometimes very critical in the diagnosis process. Exacerbation can be caused by a number of factors, among them being a young child, usually less than 4 years old, or a teenager, already having symptoms of uncontrolled asthma, not having any inhaled corticosteroids, not getting any asthmatic treatment, or not following instruction or using drugs incorrectly. Additional risk factors include allergies and smoking. Besides all that, we have some concomitant conditions like obesity and chronic renal sinusitis, pregnancy, a history of a severe exacerbation within the previous year, as well as a history of asthma, hospitalization, or intubation. This all can increase the severity of the asthma. Well, how does severe asthma exacerbation manifest? Patients with severe asthma may exhibit distinct clinical features, including a forward-leaning posture, an inability to lie flat, and the presence or absence of cyanosis. The severity is increased by respiratory symptoms, including loud wheeze, an accessory muscle contraction. We notice different types of pterygium or chest retractions, which indicate a respiratory distress. The first one is suprasternal pterygium, occurs at the top of the sternum, just below the neck. Secondly, we have intercostal pterygium, happened between the ribs, with retraction during inhalation to increase chest space. Subclavian pterygium occurs between the clavicles, indicating respiratory muscle contraction in this region. When you face someone with a severe asthma, it's very important to exclude any signs of extreme severity. In extreme cases, patients may present with neurological manifestations such as an altered consciousness, coma, or agitation, along with respiratory indicators like breathing cessation, thoracoabdominal swinging, anosculatory silence, hemodynamically a collapse of blood pressure, alongside with bradycardia, tachycardia, based on the patient's age, as well as difficulty speaking or coughing. Don't forget the respiratory distress symptoms. Paraclinical examinations are essential but should not delay the treatment. Several important tests are necessary to evaluate the severity of the condition. Arterial blood gas analysis is used to measure low oxygen levels and identify any signs of severe conditions. Chest x-rays are crucial for finding complications like pneumothorax, pneumomediastinum. Pneumomediastinum is defined by the presence of air in the chest between the lungs. An additional test is peak expiratory flow, which is an indicator used to quantify how quickly a person can forcefully exhale. A reduction of 15 to 75% indicate moderate exacerbation, where a decrease lower than 30% to 50% signals severe exacerbation. Thanks for watching. I'll see you in the next one.